Online search finds pages of stories of Kennedy's efforts to cripple farmers, ranchers, loggers, and oil workers. Others outline his disdain for markets, core freedoms, and limited government. The Wall Street Journal op-ed goes on to urge that Republican senators, quote, save the president, as if that's their job now, as if the dynamic in the Republican Party during the entire Trump era of politics hasn't been complete subservience to Donald Trump. And the truth is, Trump appears to like RFK and share his skepticism about vaccines. While he defended the polio vaccine in an interview with our colleague Kristen Welker, he told Time magazine he could get rid of certain vaccines, saying this, quote, if I think it's dangerous, if I think they are not beneficial. We should note, all vaccines administered in the United States go through an extensive approval process with multiple rounds of trials. Trump adding this, quote, the autism rate is at a level that nobody ever believed possible. If you look at things that are happening, there's something causing it. Peddling, amplifying, platforming a now widely debunked conspiracy theory linking vaccines to autism. It's simply not true. But what RFK and the company he keeps says about the future of public health in this country is perhaps the biggest storm heading our way. And it's where we start today with some of our favorite reporters and friends. Critical care physician, professor of pediatrics, and pediatric disaster response expert, Dr. Michael Anderson is back with me at the table. NBC News correspondent Vaughn Hilliard, co-host of MSNBC's The Weekend. Alicia Menendez is back, and president of the National Action Network, host of Politics Nation, right here on MSNBC. The Reverend Al Sharpton's here. Dr. Anderson, just start by telling us what polio is and how and when it was eradicated.
Yeah, it's a viral disease that causes massive paralysis. And by paralysis, I mean not only your extremities, but your ability to breathe. And I start off these conversations by saying, how many people do you know that have had polio? My grandmother, God rest her soul, had polio. We have eradicated this disease from the United States and from most of the world. It is a devastating, life-taking, life-threatening disease. And I love that CDC information that shows how many lives have been saved by this safe, very effective vaccine. Also in the New York Times, I think yesterday, was almost a primer for physicians reminding them of these vaccine-preventable diseases, how deadly they are, and how horrible it would be, specifically for kids, but really for everybody, if these diseases came back. So polio is one example of a horrible disease that we have eradicated because of vaccines.
And does the vaccine need to go away? And we should be clear, they're petitioning to get rid of it. But it seems that simply non-adherence to a vaccine schedule could expose some kids to risk. Can you talk about what the vaccine protocol is like and what the risks are if it isn't adhered to?
The risks are very, very high. You look when we have measles outbreaks where communities, for some reason, have marked decrease in the MMR vaccine uptake, and you get an outbreak of measles. So if we have kids, large numbers of kids that aren't vaccinated, there is a very high probability that, yes, indeed, polio will come back and potentially spread. So it's almost just insane that we're having debates about safe, effective therapies that have eradicated life-threatening diseases at a time when we really need to protect our kids. And it's a very, very safe vaccine. As I say, just one example of vaccines that save lives.
This individual, Dr. Aaron Siri, did some podcasts. It's just about all the Trump picks have done. Let me play a little bit of that for you.
So much to talk about, but really I just want to look forward. I want to look at the cases that we have going right now, because we could sit here and do, happy dances over all that's been achieved, but it's not over. Let me ask you this question just to start out with. I think a lot of people are going, well, it looks like, the government, Bobby Kennedy's taking the government. Why are legal cases going to even be important? Why not just say we did it, it's over?
Oh, absolutely. Well, to the extent that Robert F. Kennedy Jr. is able to really rein in these federal health authorities. And we're talking within HHS, you've got 85,000 employees. $1.7 trillion department, 13 operating divisions, CDC being one of them, FDA being another, numerous offices of the Secretariat. It's a sprawling, massive behemoth. And I think if anybody could do it, I hope that Mr. Kennedy, we hope to soon call him Secretary Kennedy.
I mean, so the plan to take over the CDC and the FDA was the plan all along. Trump has gone along with it and amplified some of that debunked conspiracy theories tying vaccines to autism. What's happening right now in the medical community? Are physicians being retrained in how to spot cases of polio and measles if this goes into place quickly?
I'm sure we will get to that point. Once again, that New York Times article was almost a slap in the face of I have to remember what measles look like. I have to remember how to diagnose polio. These diseases have been eradicated. And let me just take one other sidebar for a second. I have wonderful pediatric friends and colleagues that work at the FDA, that work at NIH, that work at CDC, and they wake up each and every morning trying to make this a safer world for children. And it is offensive to think that some sort of massive cuts are going to make kids healthier again. We have so many programs that have improved children's lives, including vaccines, that we need to keep moving forward and address a number of different healthcare issues.
Vaughn, let me play some of your interview with RFK on these issues.
You have been a crusader on questioning vaccines. Are there specific vaccines that you would seek to take off the market?
No, I'm not going to take away anybody's vaccines. I've never been anti-vaccine.
You will not take any vaccine that is currently on the market.
I'm not. If vaccines are working for somebody, I'm not going to take them away. People ought to have a choice, and that choice ought to be informed by the best information. So I'm going to make sure the scientific safety studies and efficacies are out there, and people can make individual assessments about whether that product is going to be good for them.
I mean, Mr. Siri has turned that into a lie. Mr. Siri is petitioning the government to take the polio vaccine off the market. So are Mr. Siri and Mr. Kennedy close?
Yes, but I think that this is where I think the confirmation process comes into play. Robert F. Kennedy Jr., before he can take over the FDA and the CDC, must get confirmed. And it's not just Democrats who are concerned about his position on vaccines. Republicans, too, still by and large in the United States, people trust vaccines. And in order to get confirmed, he needs the support of U.S. senators. At the same time, what I think is so interesting about Robert F. Kennedy Jr. as a political figure and a soon-to-be government official, in contrast to other nominees of Donald Trump, is that he is somebody who is not ship-shaped and molded himself over the years. He, for decades, has been fighting vaccines and been openly discussing, writing books, questioning the science that has been peer-reviewed consistently time and again that has said the vaccines on the market today are safe. And that is where Donald Trump's deference to Robert F. Kennedy Jr. is also unique. Donald Trump claims to really be the smartest guy on most subject matters. And if you listen to his interview with Kristen Welker over the weekend, he reiterated this to Time, is that he was going to listen to Bobby Kennedy and to see what Bobby Kennedy came up with on vaccines, and that Bobby Kennedy would then come to him with what he thinks should happen to vaccines that are on the market. And I think that is what is so interesting about Bobby Kennedy, is that he has been so staunchly skeptical of vaccines historically, and that once he were to get into that government position, I think there's little reason to believe that Donald Trump, based off of his own words, would not take his advice.
Alicia, we have little kids of the sort of regular
You have
vaccine.
the littlest. You have the ones who are still under 5, which has got to be particularly scary.
But I mean, the thing about vaccines is you don't have to eliminate them to endanger kids, right? You just have to cast enough doubt that maybe you miss the 4 months, or you forget the 6-month booster, you forget the 1-year booster. And someone said to me this week, you know, our kids are going to know kids that die. That's the reality.
Right, and I am as alarmed as Dr. Anderson. One thing I've learned in the process of getting ready to talk about this story is that very often polio is asymptomatic. You don't know that someone has it until either they have been paralyzed or they spread it to someone else who is then paralyzed. That is part of the danger of this highly infectious disease. And to Vaughn's point about the role that Republicans in the U.S. Senate will now play is it's not enough to broadly ask RFK Jr. about his positions on vaccines, because just like we saw in that interview with you, Vaughn, he is now bobbing and weaving. He needs to be asked about the fact that he drew a salary from an organization that is avowedly anti-vaccines. He needs to be asked about his association with someone like this attorney who, let me just underline a few things you said in that script. They are now sitting down and doing the vetting of other health officials who would come into Health and Human Services if he were to be appointed secretary. And one of the questions they are asking them is, what do you think about vaccines, right? So they are using that as a filter as they build their workforce. There's also the reality that if RFK Jr. were to take over HHS, he also would have FDA would come under his purview. All those petitions you referenced from Siri, who do those petitions go to? They go to the FDA. And so one of the questions that I would ask if I were a U.S. Senator, Republican or Democrat is, if you are in charge of HHS, are you going to commit to not intervening in these petitions to the FDA over these vaccines?
Well, they seem to be making abundantly clear that the answer to that question is no.
Correct, but I believe they have to be on the record and they have to be pressed on it, and they have to be pressed on it in a way that says exactly what you underscored, right? Which is there are these vaccinations. There's the fact that they're trying to put this pause in place, but there's also this question of, I think what they are trying to do is say, if you want it, you can get it. That is not how vaccinations work.
Right.
And they need to really get at that piece.
If they outlaw or if they cut down on the distribution of vaccines, by definition, you can't get it if you want it. For him to say during his interview, which I thought you handled well, that if it's working for them, they can keep getting it. How do you keep getting something that they're asking the FDA to bar it? I mean, it's imbecilic to even suggest that. And I think that the decades of record of Robert Kennedy in this area and in other areas, I remember in the height of COVID, when we had many black churches, including my organization, taking care of getting people tested in COVID shots. They literally marched on black churches in Harlem saying, stop distributing these kinds of medical attentions and these kinds of vaccines to people in our community. So no one has a confusion at all about Robert Kennedy, where he stands here. If you're going to take a stand, many of us have that are controversial, stand by it, but you can't have it both ways.
I mean, Dr. Anderson, can you just, I don't know if you've ever treated anyone or taken care of anyone with measles or mumps or polio, but what does that disease do to a child?
Oh, it can be devastating. This is not a bad cold. Measles, especially in children under 5, can be life-threatening with a terrible pneumonia. And obviously, once again, back to the polio, it paralyzes your respiratory muscles. So you become ventilator dependent. And if there's not enough resources, these patients can die. And I'd like to double click on one thing Alicia said, which is so important about danger to kids. And you said as well, Nicolle, there already is danger to kids because we're seeing families that are more alarmed of, well, are vaccines really safe? I thought we talked about this 6 months ago, Dr. Smith. And my dear friends who are general pediatricians continue to have to, and of course they'll do it because they want to support the families, but it's already becoming a danger because we're having these silly debates about vaccines and do they call it autism?